75% of all people that have medical insurance also have some type of a dental and vision coverage as well. So it's important that we have the right kind of coverage in all these healthcare areas. So what I'm going to do in this video is I'm going to share with you the best dental and vision options for Medicare in 2024. I want to begin today by sharing with you a print that I recently saw in my dentist office. This was just actually a couple weeks ago. I was in for my 6-month checkup where they do the cleaning, and I was waiting for the dental hygienist to come in and clean my teeth. And I saw this exact print on the wall. I got up real quickly and took a picture with my cell phone because I thought, wow, this is very interesting. And I'm also in the business where people talk a lot about dental insurance and the need for that. So I took a picture of this. But here's the whole point. It says here the health risks of periodontal disease, which of course is very common. Well, what is periodontal disease anyways? Well, first of all, the word periodontal actually means surrounding the tooth. So here's the official definition. Periodontal disease, also called gum disease, is a serious bacterial infection that attacks the gums and the surrounding tissues. If it's left untreated, the disease will continue and the underlying bone around the teeth will dissolve and will no longer be able to hold the teeth in place. As with many other oral health diseases, periodontal disease is often caused because of bacteria and plaque that build up. All right, and so I thought, well, how interesting. This chart would be there. I'm in the business making sure that people have the right kind of coverage, and it just impacted me in this way. It's very important that we do protect our oral health. This is what this says. It says oral health affects much more than teeth. Many health problems can be aggravated as a result of poor oral hygiene. And look what they mention here. They talk about strokes, heart disease, osteoporosis, diabetes, and prenatal issues. Now, for my market, the top 4, of course, are huge issues. In fact, 3 of those 4 are some of the leading causes of death right now in America. So let's talk just real quickly about some of these health issues and why it's so important to have some type of dental insurance. So they mention on the chart here a stroke. And here's what it says. Research shows that people with severe periodontitis are at twice the risk of suffering a stroke than those with good oral health. Heart disease. Oral bacteria can enter the bloodstream and contribute to clot formation, increasing the risk for heart attacks. Inflammation from periodontal disease can also contribute to the swelling of the arteries. Studies show that people with periodontal disease are almost twice as likely to suffer coronary artery disease as those without periodontal disease. And again, it's a leading cause of death today among seniors. And then osteopenia, osteoporosis, and they also talk about diabetes. Diabetes, they say, periodontal disease can negatively affect blood glucose control, contributing to the development of diabetes. Diabetic smokers have a 20 times greater chance of tooth loss and respiratory infections. Oral bacteria can be aspirated into the lungs to cause pneumonia, especially in people with periodontal disease. So on and on we go. One more thing I thought was interesting as I studied for today's video. Listen to this. It says, while there are among the most common illnesses linked to gum diseases, the ones I just listed for you, other studies have revealed even more. Now listen to this, folks. Gum disease, periodontal disease, is believed to lead to an increased risk for Alzheimer's and dementia. Researchers suggest that the bacteria that cause gum disease can travel through the bloodstream into the brain. So good health starts in your mouth. If you want to keep your entire body healthy, you need to take care of your teeth as well. All right, and so as we get into this topic, I think you understand now it's very important that we do have dental coverage. Obviously, vision we're going to cover as well. So let's get started. First off, I want you to realize that even though we're talking about dental and vision in this video, I want to remind you that you really can't make the decision about your dental and vision coverage until you first make your decision about what your medical coverage is going to look like. I know that sounds odd, but the two are going to go together, and you'll see as I make this presentation today. So the first decision we make is, what are you going to do for your inpatient, outpatient care? And so we actually, all of us have 3 options. The first one may not be an option for everyone, but I want to put it up here because there's some of you that are still working. And so if you're on some type of an employer-provided plan, I want to remind you, if you are turning 65 and you or your spouse are still working and you're covered by an employer-provided plan where there's 20 employees on the payroll or more, 20 or more, you don't have to do anything at all with Medicare. You don't have to do A, you don't have to do B at all. And so the point is, if you have an employer-provided plan and you like the plan, the cost is good, the coverage is good, you don't have to do anything at all with Medicare. So it may be your decision to stay on that health insurance you have at work. And more than likely, your dental and vision plan is going to be included. And so my whole point is, if this is your best option, then you probably already have this well taken care of. And so I want people to realize that even though you're approaching 65, as long as there's 20 or more employees on the payroll, you don't have to do anything with A, you don't have to do anything with B, you can stay on that group plan. Now, those of you that don't have an employer plan available, you or your spouses, then you actually have two options for Medicare. You can stay in what we call traditional Medicare. This means that you enroll into Medicare A and B are going to be the first payers. Medicare A and B will not pay for anything 100% other than preventive services. So when we enroll in Medicare A and B, we are responsible for what we call gaps or financial liabilities. The majority of people are not willing, and I don't blame them for taking on that financial liability. So they will buy a supplemental plan today. About 70% of all people getting SUPs are getting a plan G, 30% are getting a plan N. Both of those are a wonderful option. I'm not talking about those today. I'm just simply saying to you, when you look at your medical coverage, this may be one way in which you're going to use your Medicare. Get a supplemental plan, get a G plan, or get an N plan. They're both very, very good plans. All right. The third option we have, which is, of course, going to affect everything, is we may decide to do what we call a replacement plan or a Medicare Advantage plan. These actually started in 2003. This system here, of course, started in 1966. So replacement plans are also called, notice here, Medicare Advantage plans. Some people actually call these C plans. And so if we stay in this option here, this is government insurance where the government dictates the rules, governs how the health care is going to be accomplished. Over here, we have a private health insurance company that replaces Medicare for you. And so it's that private health insurance company that actually coordinates the care with a plan that they're now overseeing and actually directing. And so here's my point in this. If I decide to go this direction and I'm going to get some kind of a dental and vision plan, this plan is going to be what we refer to as an individual plan, or sometimes we call those standalone plans. Okay? Meaning it's going to be a separate policy and a separate premium. If I go with this option number 3 down here and I get an Advantage plan, almost always that dental and vision plan is going to be integrated. All right? And so that's why I said to you, we have to start this conversation saying, how are you going to use your insurance? Because the different dental and vision options available to you, they're certainly going to be different depending upon which one of these that you choose. Whether it's 1, 2, or 3, we can certainly get dental and vision in all of these, but the way that's going to be available to us is going to be different. So now let me explain that. Hey, if you found this video helpful and if you want to see more Medicare information just like it, then go below, right below the video, and you can give us the thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. All right, so now that we have decided how we're going to use our medical insurance, now we're going to look at the specifically about using the dental component as well as the vision component to make sure that we have the best coverage. So let's look at those options. First off, again, some of you are still working, or your spouse is, and you may have that employer plan available. If it includes dental and vision and you love it, I would stay on the plan. But I also want to mention here, I'll see this sometimes. Sometimes people have a dental and vision option as part of their retiree insurance. It's not real common, but it happens. And so you want to be sure to explore that if that previous employer will also allow you to continue on with that dental vision coverage in retirement. So that'd be a retiree plan. And then sometimes we'll have people actually COBRA. Remember, COBRA normally lasts for 18 months, sometimes 36 months. But if you have a real good dental vision plan, you're able to COBRA that, and that may be a great option for you. All right, now, those of you that are no longer working or don't have an option such as this, then that's going to take us to another option. This would be we have an individual dental plan. Now, remember where this applies. It would be whenever we have enrolled in Medicare A and B, right? And we get a supplemental plan. I told you people get a G plan or an N plan primarily today. And so what I'm trying to teach you here, when it comes to dental coverage with Medicare and supplemental plans, I want you to realize that it is almost no coverage whatsoever. In fact, for Medicare to cover something would be dental, it has to be something very serious. Someone possibly had jaw cancer and there has to be some reconstruction of the teeth because of jaw cancer, or maybe they have had you're getting ready to go into for like a heart valve replacement, and they're going to make sure their teeth are healthy because that's going to have impact upon their heart. People that have end-stage renal disease. So there's some serious health issues where there could be some dental that's included, but it's basically non-existent beyond that. Certainly not going to cover any kind of cleanings or extractions or fillings or crowns, things like that. Not covered by Medicare, therefore not covered by your supplemental plan either. Okay, so that means that if I stay in this system of A and B, I get a supplemental plan. Now I'm going to have to get what we refer to as a standalone plan. And again, these individual dental plans. Okay, so I'm going to explain how standalone dental plans work. And again, there's a lot of companies who offer these. We're brokers. We write several of them, but they're all pretty much structured the same way. So let me explain the different components of a standalone dental plan. So we have basically three types of service. We have preventive services. We have basic services, which would be kind of your low-cost items, fillings, extractions, things like that. And then we have major services. And this is going to be your big-ticket items. It could be root canals, crowns, sometimes dental implants, dentures, sometimes those kinds of things where it's pretty major type of services. So let me explain as a general rule how the plans work. So when we go on a plan, our preventive services are almost always covered with no deductible, and they're usually covered at 100%. And what we normally get is we get 2 cleanings a year and a set of x-rays once a year. And that is covered immediately. There's no waiting period on that typically. Now when it comes to basic services, again, these are your lower cost type items, extractions, fillings, and all that. These are normally covered by the plans at 80-20. Sometimes we'll see a 90-10 plan, which means the plan pays 80, you pay 20, or plan pays 90, and you pay 10% of that service. Now these services, with this exception that I'll explain in just a minute, these services are normally covered about 6 months after you've had the policy. Again, there's exceptions, but typically 6 months of having paid premium into that plan, now those things are going to be covered at 80-20. Now when it comes to major services, again, root canals, crowns, implants, those kinds of expensive items, these are normally covered at 50-50, okay? 50-50. That means plan pays 50 and you pay 50. And again, these things oftentimes, though, are not covered for 1 year. They call that a waiting period. So again, these sometimes can be 6 months. These are immediately, okay, 6 months and 1 year. Now there's an exception I'll teach in just a second, but here's my whole point. You can see that we have things covered other than preventive. We are going to be out of pocket some, but we get a dental plan because that plan is going to pay some of these expenses. And if we have dental issues, they'll cover quite a bit. Okay, so that's a standalone dental plan, and again, almost all of them are structured that way. Now I also want to talk about the monthly premium. And again, this is going to vary around the country, but right now we're seeing plans in the neighborhood about $45 to $55 a month for a plan that gives us a fairly generous annual max out of pocket. So when we look at these services, these companies are going to have some kind of an annual max. Okay, so if I have a plan that I'm spending about $45 to $55, I'm probably going to have an annual max somewhere in the neighborhood of about $2,500 to $3,000 for the calendar year. That means what this company is paying, that 80%, 10, 50%, usually these are not included, that's an addition, but what they're willing to spend is up to that plan max for that year. And then again, a calendar year later, it then will reset. After that. Okay, now that would be a plan here. Now we'll see some plans that are going to maybe be in the neighborhood of about $35 to $45. That range a little bit cheaper. Those plans are going to have somewhere usually around a $1,500 to about a $2,000 max. So when we look at premiums and you see the difference, it almost always has to do with what is the annual max that plan has established. Okay, and so that's the way these plans are going to be structured. All right, so I want to make sure you're clear on that. So let me write it up here. So somewhere between about $35 to $55 on a monthly basis. So it's a separate plan and has a separate premium. And then lastly here, I want to talk about the best time to buy. The best time to buy these plans would be this. You want to buy it as you transition out of that employer plan into an individual plan. Most of the carriers will actually waive the waiting periods. So they will get rid of the 1 year and the 6 month wait, and they'll actually cover you immediately as long as there's been no longer than a 60-day lapse from the time that you lost your employer plan. plan. Now, the majority of people, if they're going to lose their employer plan June 30th, they want their dental coverage to start by July 1. But if they put it off for 2 months, July and August, at least if they start by September, there's no more than a 60-day lapse, and then those waiting periods will be waived. But if we wait beyond that 60-day window, most of the carriers then are going to make us wait for those periods, either 6 months or the 12 months. Okay, so that's the way these plans are going to work if we have an individual plan. So we have A and B, we got a G plan or an N plan for a SUP, and now we have a separate premium for that dental plan. All right, so that brings us then to our third option. So we've looked at employer option, we've seen individual plans, and now we're going to look at the integrated dental plan. So this means this is someone that actually has enrolled in a Medicare Advantage. Remember, these are called replacement plans or C plans, a private health insurance company that replaces original Medicare. And so what these plans are going to do is they have lots of different perks. And one of the perks will actually be a dental plan. A dental allowance, actually. And so we have some dental coverage within or embedded within that plan. That's one of the perks. They'll throw in a gym membership, usually some kind of an over-the-counter benefit, sometimes hearing aids, those kinds of things. So let's talk about the dental portion of this perk integrated within the Advantage plan. So first off, they will give us an allowance, okay, where some companies, when we have a standalone dental plan, will set a max out of pocket for the year. Companies with these Advantage plans, we'll call that an allowance. And so again, it's going to vary. And again, folks, there's 4,000 plans across the country right now. The average market has about 45 different plans. Okay, so the dental allowances right now are ranging anywhere from about $1,000 on the low side, and some of them go up as high as $3,000. For the year. And what that means is they're saying they are willing, the Advantage company is willing to spend this much money for your dental coverage. Now, most times the verbiage that they use is called comprehensive, okay? Comprehensive, which means what? That means that they will pay for preventive services as well as comprehensive services. So again, extractions, fillings, root canals, sometimes dentures. And so they'll spend up to whatever the limit is for that plan. And of course, all Advantage plans are a contract year, so that would be during the calendar year. All right, so it's going to have some kind of an allowance. You just have to find which one. Now, the next issue with these would be networks. Now, this becomes a kind of a bigger deal with Advantage plans versus individual plans, because most individual plans are PPO plans. You can actually go to any dentist that's willing to take the plan. With some of the Advantage plans, you have to find out, do I have to go to a network dentist? And many times you do. So you've got to ask that question for you to use that allowance. How can you use it? And so this would mean that this could be either a dental maintenance organization, kind of like an HMO, but it's the dental side, or it could actually be a PPO, which would be a little bit of a broader network. But be sure you find out, if you have the Advantage plan, what would be the networks, because it could be your dentist is in there or not in there. And if they're not in a network, then they may not take the plan. You can even use that allowance. All right. And then the last issue here I want to talk about is actually claims. And so this is going to vary from plan to plan. So we put up the words here, assignment or reimbursement. So if you're on a plan that says this allowance that you can use will take assignment, that means that the dentist can actually build the plan, and the plan then will pay the dentist direct. Remember, you have no responsibility at all. You get the services, give them your card, and they take care of the whole claims process. You don't have to be involved whatsoever. This actually is the easiest way. It's not, however, the most common way, though. Okay, most of the plans are a reimbursement plan, and that means that typically this is going to be a PPO plan, and you can go wherever you want to go. But what will usually happen is you have to pay for the service up front because the provider can't bill the Advantage company. You have to pay for it, and then you pay for it, and then you'll get a receipt, and you submit that receipt along with a very a simple little form you got to fill out called a reimbursement form, and they will actually give they'll send you a check, of course, up to the limit for that plan. And again, this just means you got to pay up front, but they'll process these claims pretty quickly and get that money to you. All right, so just want to make sure you know that if it's going to be an integrated, these are the kind of things that you need to be looking for, the kind of questions you have to ask to make sure that you're going to be able to use that dental allowance. Hey, Medicare can be very confusing. In fact, people make mistakes all the time because of how confusing it is. So what I've done is I've actually actually created a Medicare, notice this, Essentials Workshop, where you have the opportunity to really learn everything that you need to know about Medicare so that you can make Medicare decisions. There are thousands of people every month that watch this workshop, and we get lots of reviews saying that this is something that really was helpful to them. And so what you can do is down here below in the comments section, you'll see where it says pinned comment. At the very top of those pinned comments is a link. And you click on that link, what we're going to do is we're going to give you free access to this Medicare Essentials Workshop. And we want you to watch it because we don't want you to make any mistakes. All right, that brings us into the vision component of our coverage. So let's talk about those options. And again, same thing applies. If you have an employer vision, keep it if you can. Usually the premiums are very low. Those are typically large group plans, and they're very, very attractive. So hopefully you can hang on to that. Now, if you can't, that means you're no longer working, your spouse is no longer working. We don't have that as an option. Now, if we want to have an individual vision plan, what it's going to look like is this. Now, why would we get an individual plan? This is because we decided to enroll into Medicare A and B, and we got that supplemental plan G, or we got that supplemental plan N. And so what's going to happen here, remember how the dental, there was no coverage? It's not like that when it comes to vision. Both Medicare and supplemental plans pay very well on vision. So they're going to cover things like cataracts. They're going to cover things like glaucoma. All right, even glaucoma screenings. They're going to cover wet macular degeneration. They actually have a thing called macular degeneration. It's the wet form that's the worst, so wet macular degeneration. So they actually will cover that. That means typically there's injections going in the eye. Any kind of issues where you're needing some type of help with the eyes, meaning you're having some kind of a stigma or something, then those things will be, of course, diagnosed and treated as well. And so my point is you have wonderful, wonderful coverage with Medicare. In fact, let's see, if cataract surgery, right now, I think the average cataract surgery is about probably $3,000–4,000 an eye. If you had that plan G and you hadn't met your deductible yet for the year, that whole cataract surgery on both eyes would only cost you $240 for the whole year, because that G plan will pay everything other than the B deductible. If you've already satisfied your B deductible, then that cataract surgery would cost you nothing. Now keep this in mind, both with original Medicare and Advantage plans, they only cover the basic lens. So if you do an upgrade, that course would be out of pocket. But my point is, in this system, unlike dental where there's no coverage, vision is wonderful coverage, okay? And so if Medicare pays, and they pay for a lot of issues with the eyes, then the supplemental plan will follow based upon the plan that you bought, okay? So we have very, very good coverage. All right, now why then would someone get an individual plan if they have original Medicare with a supplemental plan? Well, the reason is because there's two items that are not covered by Medicare nor the supplemental plan, and that would be this: any kind of eyewear and exams for eyewear. These two kind of things, we have no coverage whatsoever. Okay, they're just not going to cover those. Now, there is one exception. If you have cataract surgery, Medicare will pay for a new set of glasses after cataract surgery. But other than that, just your normal, get new frames, new lenses, those kind of things, not covered by Medicare. And the exam for that, the eyewear is not covered either. But other than that, we have wonderful coverage. Okay, so that's why people get standalone vision plans when they have A and B with the supplemental plan, to get those kind of things covered. All right, and so they have, again, monthly premium, just like a dental plan is. Now, again, I'm not promoting any company at all here, but the two primary plans that we sell right now, we sell an iMed plan that in most parts of the country is about $10 a month. And if you want a network called VSP, which is the biggest one, I think that right now is about $16 a month. So they're really very low cost. And what will happen with both of these, they're going to have different networks, of course, but what they'll do is they'll throw in one routine eye exam a year, and then they will help cover some of your glasses, the lenses, the frames, and those kind of things, and contacts up to a certain limit. Okay, so again, very, very low cost if you want to have those add-on plans. So Medicare covers well, other than those two items, so that's the way to get that coverage taken care of. All right, now the best time to buy, let me put this up here, really anytime. These are not like dental. We don't have any waiting period, so anytime you want to add a vision plan, you can do so. All right, and so again, about 75% of all people today do have dental and vision add-ons with their original Medicare and supplemental plan. So that's the way they work. All right, that brings us into the third aspect here, and that would be integrated vision plan. So again, what does this mean? This means that we enrolled into a Medicare Advantage plan, that C plan, that replacement plan, and again, our vision is going to be another perk that's going to be available to us. Just like the over-the-counter, the gym membership, the dental, we're going to have a perk that's going to include dental. Let me explain how that's going to work. Again, they have an allowance. And again, 4,000 plans in the country, so I'm just giving you a ballpark. We're seeing this year in the neighborhood of about $150 to $200. Oh, let's change that to $250. I saw a plan the other day, it was actually $250. $250, and this is a credit for eyewear. And they will pay for one routine eye exam a year. Now, normally, as you'll see up here, we do have to go to a network provider to be able to use that benefit. They want you on this routine eye exam to go to someone within network. And then there's really typically no network on this eye allowance. They just let you go where you want. And again, the claims process can be the same. If the doctor takes assignment, which they probably will in that situation, there's nothing out of pocket. They'll actually build a plan. And if you have to get your glasses out of network, then you will just keep the receipt, pay for them, keep the receipt, and then turn in a medical reimbursement form, and the Advantage plan will then do the reimbursement for you. All right, so I hope you can see why I said at the very beginning, you have to decide what your coverage first medically is going to look like, and then that lets us look at our different dental and vision options.